Hi everyone, we should be live. I'm just going to double check. I'm Simona. I am the founder of the Cavernoma Society, and it is Brain Awareness Week. So we are sharing real life stories this week with you guys of our members who have been through Cavernoma, who are living with Cavernoma, who have experienced surgery, seizures, bleeds, etc. And today I'm really fortunate to have James with me, who is going to share his story, which is quite unique. Before I start, I'm just going to quickly double check that we are live. Let's have a look on our page just to make sure. This should be streaming to Facebook, so we are live on Facebook. That is a good start, James. We are live on Facebook. Let's have a look if we are live on Instagram as well. Let's have a look. This should be, are we live? Let's have a look. It's not showing live for my Instagram yet, so I don't know. Let's have a look. Why are we not live on Instagram? Let me have a look. Let me see if this is because I haven't saved this. Here we go. I'm going live here. Let's see. Here we go. I think we're live. Woo! I think we're live on Instagram as well. There we go. So I'll start again because we are live on Instagram as well. So thank you everyone for joining us this evening. My name is Simona. I am the founder of the Cavernoma Society. A lot of you know me. If you don't, hello and welcome to our new members. It's a pleasure to have you with us. I am going to be interviewing a few of our members across the week because it's Brain Awareness Week. So happy Brain Awareness Week. And we're trying to raise even more awareness of Cavernoma because, as you all know, I'm sure a lot of Cavernoma patients suffer with the frustrations that they're not understood. It's not a condition that's regularly understood by neurologists, neurosurgeons. No matter what specialist they are, it can be misdiagnosed. Often you guys are left feeling quite alone, and that's what we're here to help you with. We're here to help you feel less alone and show you that there is support out there. Sometimes you just got to kind of look a bit harder for it, unfortunately. But I'm really fortunate this evening to be joined by James. He is one of our members. He's actually quite a new member. I think, James, you joined us maybe like last August, July. And the reason James got in touch actually is because his story is pretty unique. So what I will say is that all of these stories that we're going to be sharing, there are going to be things that you relate to for sure, because obviously there are so many aspects of the journey that are similar, but there will be other things that maybe aren't similar to your story. But please keep an open mind, because what we are here to do is learn from each other and to support each other. And we're just going to be sharing our experiences. None of us are medical professionals, so this is not medical advice, but we are here to show you that you're not alone. And that, James in particular with his story, I think is very inspirational, the way that he's kind of helped himself, the things that he's kind of been proactive with. So I can't wait to kick off and share James's story with you, because he is, like I say, very unique. James, welcome. And thank you so much for joining me this evening. I'm so honored to have you here with me. And, thank you for agreeing to do this. But your story, as I keep repeating, is unique. And can we start from the very beginning? Okay, so I know for you that your Cavernoma was maybe diagnosed out of the blue, but you'd kind of started experiencing different kind of warning signs that obviously now you realize they were kind of preempting what was going to happen. But at the time you didn't think, or maybe you did think twice, but you just didn't think of how serious, the consequences could be. So you were diagnosed in, what was it, May 2022?
May 22, yeah.
Yeah, and how did it all begin for you?
It sort of started probably about a month before that. So I was sort of getting the odd headache. But as I've said to you before, we're sort of approaching May, and the weather's getting warmer. I'm working hard, and at that point in time, I sort of just thought maybe I'm not drinking enough water, maybe dehydration at the end of the day. There were times when it was sunny, and driving home, again, like I said to you, you're sort of driving down the road and you've got these gaps between trees where the sun's sort of blinking as you're driving. By the
Yeah.
time I get home, I'd have a headache and just think it was that. It was just being sensitive to sunlight. But progressively, it would go from one sort of every couple of days to sort of a little bit of one every day that would then go away. Um, I'm going to bed earlier, thinking did I stay up too late watching Netflix last night? You're thinking of all these sort of little things. You never, like you said yourself, you never think it's something so serious.
It's funny though how we question ourselves though. We think about our diet, we think about what we're eating, what we're drinking, whether we're sleeping enough, which I mean, all of those things are very reasonable to consider, but it's funny how we don't think, oh, this could be serious, maybe I should go and see a doctor. We kind of look for the solution ourselves.
Well, it did get to the point where I felt like my right ear was blocked. Again, maybe a wax build-up. Do you know what I mean? It's you're not thinking of that next step beyond. It's like so. I did go to the GPs at that point, and complained. Just said, I think I've got a blocked ear. So he had a look at it. I did mention to him at the time, though, when we were sat down, that one sort of migraine woke me up about 3, 4 o'clock in the morning. My GP said, well, that's weird because a lot of people would go to sleep to get rid of a migraine. So I
Mm.
think that sort of worried him at that point. And he actually referred me um, to get a neuro sort of scan.
Okay.
Um,
So
that
he did think it could be serious then at that point, or he was just doing like all the what he thought was right.
Yeah, I think he was probably following up routine with, yes, I had a blocked ear, or it felt like I did. Um, but with the fact I'd said this one particular headache woke me up at 3, 4 o'clock in the morning, and I was literally in the bathroom with both hands cupping cold water against my head. It was that bad. Um, and I was having these funny spells occasionally where it would almost like be a sort of panic attack out of the blue. I'd feel sort of numbness in my left foot that would then sort of transfer to my sort of up my left leg, um, and that would sort of panic me, and my heart would race. Sometimes more than often, I would have to lie on the floor on my back and sort of do these breathing techniques to sort of bring myself out of it. But
Wow.
then with that, I'm thinking, is that me getting anxious of the thought of what's going on? So that referral was for the 13th of May. Never went through. It just said your referral is being reviewed. So I wasn't actually seen to. I didn't have a scan. Now what I'll do is I'll take you to the point of the 16th of May. So we're talking 3 days after I was supposed to have a scan.
Okay.
So 3 days later, I'd actually gone to training. I'd actually gone to jiu-jitsu.
Oh yeah. So you're just to explain to everyone, you do jujitsu and you compete, don't you? You are kind of what semi-pro?
No, no, it's not semi-pro,
Is it
Simona.
pro? Is it pro? What is it? What is it? Tell us. Tell us.
No, it's not semi-pro. I mean, the place where I train at is a very, very high level.
Okay.
I've always said that. I've got a great team there. My coach, especially, is a very good friend. Pretty much all the team are good friends, if I'm being honest. So the level that we do sort of compete at is sort of top level. Obviously, there's different grades of belts throughout. So we've got sort of white up to my coach that's black belt, but we all sort of try and compete at a good level to keep ourselves sort of strong in the game, if you will. But
Yeah.
on this particular Sunday, when I went to training, it was one of those things where I said to my partner, I said, I'm going to go training, sort of try and clear my head. Do you know what I mean? It was one of those situations. So I went and did a gruesome sort of hour and a half training. And when I'd finished, I was just, my head was banging. And I drove home. In fact, I drove to the shop to pick up some coconut water because I actually thought my head's banging. I'm dehydrated. I need some electrolytes. Let's pick up some coconut water. And I went to the shop round the corner from ours. Picked up some bits of stuff. Weirdly enough, as I walked round the second aisle, and I remember this like it was yesterday. As I walked round the second aisle, the vision in my left eye all of a sudden went from clear to seeing these almost like sparkly zigzags. Do you know what I mean? It was like my vision went into this kaleidoscopic visual shimmering zigzags.
And was that the first time for you? Like, was that the first time you'd ever experienced anything like that?
First time I've ever noticed that. In my,
Right.
so, at the time being 41 and, considering I feel I've looked after myself and I'm a sort of athletic lad who eats well and stuff like that, that was frightening.
Yeah.
That was frightening. I'd never experienced that. So my anxiety levels obviously went through the roof. So I just paid for this stuff and got out of there and got home. And I mentioned to my partner Shannon, I said, I don't know what's happened then, but my vision's almost got these sort of shimmering zigzags, and I'm blinking, and it just wouldn't go.
Mm.
So, I mean, my partner said, "Look, you've been having migraines. You might just be getting an aura from migraine," which is true, understandable. She said, "Why don't you have 2 paracetamol and get yourself in bed for a bit?" Which I did. In our bedroom, we've got a blackout blind, so it was that perfect setting to just get some sleep after an hour and a half's worth of training, A little bit of coconut water, 2 paracetamol, fell asleep, and within 10 minutes, I had this sudden throbbing on the right hand side, and the pain was just unbelievable, honestly. It just wouldn't stop. It wouldn't stop. Now, sort of bear in mind, this is a Sunday, so my first thought was dial 111 out of hours GP. So I'm on the phone to the out of hours GP, explained everything that I've pretty much just told yourself. I did mention about the missed referral for a scan, and I said, but honestly, it's absolutely killing me. I said, even the light is hurting me now. And she said, you need to get to A&E. So off to Wigan A&E I went to. Sat in the waiting room. Now, a lot of us have sat in probably hospital waiting rooms, and the sort of little square tiled lights that they have in those waiting rooms. Now, even them,
They were affecting you, yeah.
even those were giving me such a bad headache.
Wow.
I mean, to make matters worse, there was a girl in the corner who was whistling, and by now, that whistling sound sounded like an ambulance siren in your ears. It was that bad. I must have got really sensitive. But so they took my blood straight away. And funny enough, 15 minutes later, she came back with the results and said everything normal.
Okay, that's interesting.
Very
Well,
interesting.
the blood, they do tend to say that, don't they? Because really, it doesn't. I mean, I've never known anything to really be obvious in the bloods from Cavernoma. I
Yeah,
mean, I know that they are looking for blood markers and they're trying to develop blood markers for it, but
yeah,
actually, what could it show, really?
nothing. I don't think it could show anything, Simona, because it's sort of, yeah, it's all right. It could be a bleed. I didn't know that at the time, but sort of having a blood test is not really going to show that. It's just going to probably show the levels of let's say sort of liver function or kidney function or sort of I don't know. It's just going to give all these facts. Do you know what I mean?
Yeah.
And then sort of 10, 15 minutes after that, they took me in for a CT scan. And again, 15 minutes later, the guy said, we need to take you upstairs to resus.
Wow. How did that feel?
Well, not being the most sort of hospital educated person, I said, "What do you mean? What's resus? What's resus?" But I hadn't a clue. Um, so yeah, straight up to resus, and before I knew it, I was in this bed with just my tracky pants on, all these sticky pads on me, heart monitoring machine. Now my anxiety is through the roof.
Yeah.
They found something. Uh,
Wow. And they weren't explaining it to you?
Not at first, no. Now, bear in mind, I've sort of said, I've said to this guy, I said, "What's going on?" He said, "The consultant will come and have a chat with you in 5 minutes." And I'm trying to bring myself together. My heart is racing. I know they found something. So then I remember the consultant sat on the end of my bed and said, "James." I said, "Yeah." He said, "Hi, James. The CT scans come back and we've found a mass bleed on your brain. It is a CT scan. We can't entirely see what's behind this cloud of blood. So at the moment, we can't rule out a tumour."
Wow.
And I just, honestly, I literally sunk through that
Yeah.
bed. I just didn't know what to say. I just did not know what to say. I just thought, you know what? Again, 41-year-old, and I feel I've looked after myself. Like, and then you're thinking, why me? And then ultimately, I'm thinking, did I bang my head on some scaffold once? Like, someone need me at jiu-jitsu. What? You just again, you
Start thinking of every scenario. Yeah, for sure. But I think as well, I mean, I can definitely, I understand and I can relate to the whole, like, first of all, that gave me shivers, by the way, when you said that, because I know, like, when I was diagnosed as well, it was kind of a bit blasé the way they told me. And I was almost like, you're going to need brain surgery. And I was like, oh, okay. But I think it's the fact that, you do definitely start thinking, why me? That I think that's so normal. And then you feel guilty because you think, okay, well, wait a minute, there are other people that are worse off than me out there, etc., etc. But it is true. I mean, I think that there's no shame in feeling that why me, because especially if you're not, I don't know, you've looked after yourself, you've eaten well, you're not a smoker, you're not whatever it is, and you think that there are people out there that don't look after themselves and they have quite a healthy life.
correct. I, I think it took a good while for sort of acceptance, considering you've just been told we can't rule out a tumour.
Yeah.
To which at this point, I mean, this must have been by now, it must have got to about 12, 1 o'clock in the morning, and I'm still sat up and I'm messaging my mum, I'm messaging my fiance, "I'm going to die." I'm messaging those words.
I
I'm
was
going.
gonna say, did you feel that kind of that sense of morbid, whatever
Yeah,
it's called? Yeah.
yeah. Absolutely. I mean, soon as someone says the word tumour, you ultimately think,
Yeah, you instantly feel, yeah.
you know what I mean? That is it. It's game over. That's just what I thought at the time. Um, I mean, progressively from there, they kept me in straight on with codeine to keep that pain away. Um, then they put me on a steroid drip to keep the swelling down. And I must have been there for probably about a week and a half, 2 weeks maybe. And then one night, it must have been between 9 p.m., 10 p.m. Curtains open. She says, "Right, James, get your stuff together. You're going over to Salford." So they blue lit me in the ambulance,
Wow.
took me straight over to Salford Royal, which is obviously the neurological department.
Yeah.
So, and that was it. So then I was in a room at Salford on my own, and again, we still didn't know what this was. We still didn't know what this was. It was only the day after they had they actually put me on a ward, and then progressively, I'll try and keep it sort of short for you. Progressively over 2 weeks, they probably did about 3 or 4 sort of MR scans.
Yeah.
Um, Still couldn't quite work out. There was this bleed, but what's behind it? Now, in between that time, and let me just make sure it's a warning to other people. In between that time, I'm in a hospital bed with my phone. I'm googling.
Right. So you were trying to find everything out, like what could it be? What could
Yeah, I'm googling. I'm googling like mad. I'm looking at aneurysms. I'm looking at tumors. I'm googling, and it's making me worse because
is it raising your anxiety?
yeah, and each one, you can't help but look at the severities. You're looking at the death side of things.
Yeah.
You're not sort of looking at what can be done. You know what I mean?
And what about at this point, what about your family? Because you mentioned obviously you told your mum, your fiance. Are they the same? Are they showing the worry, or were they trying to be brave for you? Were they kind of just
Com-
quiet and
Family, friends. I think a lot of people were very shocked because again,
okay.
this, I'm this sort of guy who looks after himself. He's, I played football. I do jiu-jitsu. He's always doing well, James, and he's always doing. And then all of a sudden, boom! Wow,
Yeah.
guy in this position now. All of a sudden, do you know what I mean? But yeah, like I say, progressively at Salford Royal, um, they did a they did one or two scans, and then they did. I had to have an angiogram. Um, so they put me under a general anaesthetic, and I had to have an angiogram. Um, from there, they then put me through this sort of top of the range Tesla scanner, and then the consultant, um, he said, it's Cavernoma. It's benign. It's benign. So that was a big. I think that brought everything calm, saying that it was benign. It's Cavernoma. It's a right side um, cerebral malformation. So now we can at least sort of educate ourselves outside the consultant's time on what is Cavernoma. I've never heard of this. What is that? He explained everything to me. But sort of again, following up from that, when they got that scan image back, you could quite easily see. I mean, I wish I had it with me to sort of hold it up and show you, but you could see this mass bleed. You could see this huge swelling on the brain that was pushing on the the sort of frontal lobe. It was really pushing the frontal lobe out on this side,
Hmm.
and it was a case that I almost felt like he was giving the impression we need to act fast with this one.
Right.
Um,
Yeah, because yours. I mean, I wish we'd have kind of got the picture up, but you could see how big that area was. It was definitely, you could see the inflammation, couldn't you? You could really, it kind of almost taken over half of your, like, well, at least a good third of your brain, right?
yeah. So I mean, when you look at sort of, if you look at the average, I mean, I know cavernomas are all different sizes, but when you look at the average sort of cavernoma being sort of 1.5 mil,
Yeah,
mine was 45 mil.
yeah, which is 4.5 centimeters.
Yeah, so that was pretty big.
Yeah, and I think this is where, I was saying at the beginning that everybody's journey is different, and there will be so many differences. I think no Cavanoma patient. I don't want to call them sufferers because it sounds negative, but
Mhm.
no one's identical. No one has exactly the same story, but I
Yeah,
think that there are similarities, and I think when we get people get in touch with us, the first thing that they do, obviously, there's a kind of a great panic, which is quite normal, isn't it?
yeah.
What's the prognosis? Am I going to die? Because they at that point haven't really been told by their specialist, what is the prognosis? Is this dangerous? They've been told it's benign, so they think, okay, benign. But
Yeah,
then they think, okay, well, and then they start Googling. And I
yeah,
think the problem is, Google, as great as it is for so many different things, first of all, there isn't enough information on Cavernoma out there for Google to actually be useful enough, I think, because even the NHS website gives you so many basics. It's like a 1 in 600, 1 in
Yeah,
2,000, 1 in 400,000, etc. Which, you know, when you're going through it yourself and you're thinking, okay, mine's 45 millimeters, what does that mean for me? It's not specific enough. And I always say to people, like, you know, we have obviously had cases where we've got members that have lost their lives to cavernoma, but it is very, very rare because
yeah,
cavernomas bleed very, very slowly. It's
yeah,
not an aneurysm, it's not an AVM. They bleed they kind of seep blood very slowly. So it's
yeah,
quite unusual to die from it because most of the time you will get seen to before you've even got to that stage. You know, you'll go to the doctor because you don't feel well. So a bit like your banging headache, most people will go, okay, this isn't normal, I'm going to hospital. So obviously that is a positive. They're quite slow to cause a problem.
yeah,
But at 45 millimeters, and you know this yourself, that's when it is causing a major problem because
yeah.
at 1.5 millimeters, the amount of blood it's going to seep into your brain is tiny. At 4.5 centimeters, that's suddenly becoming an issue, isn't it?
Yeah, I mean the high risk of what it was on the scan image was you could see the bleed, you could see this round shape where the cavernoma had sort of burst, but behind the cavernoma itself was also a hematoma.
Right. Okay.
Now, obviously, with you saying, um, and I know that the blood in cavernomas moves very, very slowly. I think with having the bleed and maybe the sort of blood circulation has tried to sort of work its way back round as if it's trying to sort of mend itself in a sense, has just sort of started to lodge behind the cavernoma. So we've got this bleed, we've got this 40 mil, 45 mil cavernoma, we've got this swelling on the brain, and we've also got this little hematoma that's hiding there. So I was in a bit of a bad place, you know what I mean? It was like they needed to sort of act fast. So
Yeah.
from there, then it was consent form. So
Really? Straight away. So basically, from diagnosis to surgery, yours was pretty quick.
yeah, absolutely, yeah, it was sort of consent form. I mean, he sort of give us the two options of radiation blasts.
Yeah. The gamma
But
knife. Yeah.
yeah, so and then obviously surgery.
Yeah.
So I was like, you know, I said, so what does sort of the radiation blasts do? And it will obviously sort of burn it on the end, but there's nothing to say that sort of 5 years down the line that's going to bleed again. Um,
And I think because it's such a new, I mean, not to disregard it at all. You know, I know that there's lots of studies being done on it, but because it's still a relatively new treatment, it's still hard to actually know whether, because again, we know so little about cavernomas. So, for example, you know, I had 3 bleeds in 3 months, but somebody might not have 3 bleeds in 10 years.
yeah, yeah,
Everybody is different. So, to kind of say, okay, it's the radiation, the gamma knife that stopped it from bleeding, I think at this point it's still quite debatable. It's still quite hard to say, was it going to bleed anyway? Was it not going to bleed? You know, who knows?
yeah.
And I guess you at that point you must have then weighed up the pros and cons. I mean, what was going through your brain at that point, thinking, okay, brain surgery where they're actually going to cut through my skull,
Yeah.
or radiation? Because even radiation sounds scary, doesn't it?
Yeah, radiation does sound scary. And I was sort of weighing up the way I felt at that time with the headaches, the panic attacks. Just, I just wanted rid.
Yeah.
It gets to that point where I just don't want to be like this anymore.
But did they tell you that this was a fix for you? Is that what they were selling it to you as? Was it like, if we're going to remove this, then you're not going to have any more headaches, you're going to be okay, you're going to make a full recovery, etc.? Is that what you were being told, or was it a case of, oh, if we remove this, then obviously the pros are that you've got less chance of a bleed, etc., etc.?
No, he did say that
Yeah.
once we drain the hemorrhage, that alone would probably stop these sort of severe, gruesome headaches that I was getting.
Okay.
So all right, yeah, it was probably a selling factor, but I just wanted rid of the headaches most of all because I just could not put up with them. Even the codeine got to the point where it wasn't working. It was that bad. So yeah, I'd signed the consent form, and I think it was the 22nd of June, 22. General anaesthetic, 7 hours in theatre, and next thing I'm waking up with a bandage wrapped around my head.
And how did that feel? Obviously, I know you're at that point. You're dosed up on medication. I know. For me, waking up from surgery, the first thing I thought was, I'm not in pain. I was expecting to be in excruciating pain, having had my head drilled into, and obviously because you're so dosed up on medication. The thing that was most irritating for me was, I don't know if you had this, but I had like a popping sound, like a snap, crackle, and pop from all the air like leaving my skull, but also this tube that's obviously draining the blood. I thought that was the most irritating thing because I couldn't sleep properly.
Well, I had, but bear in mind they drained the hemorrhage
Yeah.
through surgery with me.
Yeah.
But yeah, I mean, from my experience, I remember waking up, my face was full of Vaseline, and I remember sort of putting my fingers slightly up towards my temple, sort of up the side of my ear. I felt the first staple, and I was like, oh, they've done it. They've done it. Wow. And I sort of nodded off for 5 minutes, but the same as you, I could hear this. I'm thinking, God, my skull's going to cave in. What's they done? You can't help. I think, what's that noise? But I knew they'd done it. I felt no headache at all, and it was just this breath of fresh air.
So it was a relief to you. You were happy.
Absolutely, yeah.
Did you at any point think, oh my goodness, I've got this massive scar and I've got these staples in my head?
Not at that time. No. I remember it being, at the time, it almost felt like one of the happiest days of my life. Seriously.
Don't tell that to Shannon. That's going to be your wedding.
No, that's coming up, so don't worry about that.
Okay, so you felt better already. So to you, you're thinking, this has gone well. This was a great risk to take. Like, it's come out positively. What was everybody saying around you? What were the doctors saying? What were your family saying? Was everybody really positive at this point?
Yeah, I mean, when from your own mentality, you're thinking you're pretty much on death's door.
Yeah.
And all of a sudden, these amazing surgeons have give you that second chance in life with no headaches, and they took whatever it was that was causing that out, and you're fixed. And now, and the moment, and obviously Shannon are turning up, and they've done it, and it's just things straight away start to feel good again.
Yeah. I've had a couple of questions in, James. I wonder if we can quickly run through these before we move on. Give me a second. I'm just these are coming on Instagram. I can't see Facebook ones. My daughter is waiting for surgery to remove her cavernoma from her right temporal lobe, which is where yours was, wasn't it, James?
Yeah.
Did you have any issues following your surgery? E.g. tonic-clonic seizures or vision issues? Did you have issues after surgery?
Well, I know we've sort of not finished yet, but
yeah.
the first surgery, I was getting a little bit of a sort of memory impairment.
Okay.
Yeah, there was just a little bit of a memory impairment. I was sort of struggling a little bit to sort of be fluent in a conversation. I was stuttering and muttering a lot. I couldn't. The word was there, but I couldn't get that word out in the conversation.
Although that sounds, I mean, sorry to interrupt, but I mean, I was exactly the same, and you and I both had, I mean, ours were in different places. Mine was right frontal lobe. And I think that this is probably an impairment of surgery in general, right? It's, they've gone into your brain. They've kind of, I always describe mine brain as a bit of like a cocktail. They've shaken it up, shaken, not stirred.
Yeah.
And it's kind of settling, isn't it? So I definitely had the word finding, I was speaking backwards at one point. My sentences, my words were jumbled. It seemed like a very real sentence to me, but it wasn't.
Yeah.
So these things they seem quite normal post surgery. I mean, did you have any movement issues or anything like that? Because you mentioned obviously your foot had been affected in the run up to being diagnosed. Were you having any issues with movement?
So pre and post. This is pre and post surgery. I was getting. Do you know how I explained about the panic attack before?
Yeah.
So, and all of a sudden, so weirdly enough, I was getting this sort of almost like a deja vu moment, and then I knew from getting that, I knew it was coming, and this was post surgery. So even though this headache's gone and this horrible pain and this swelling is starting to sort of disappear, I was even in the hospital post surgery. I was still having these moments where I would, and it only lasted a minute, but it was almost like sort of being swallowed up, and I'd close my eyes and have to breathe. I'd have to sort of control it. Now the nurses at the time, I would sort of panic and call for the nurse on the buzzer, and I'd ask them to actually get a towel under the cold water and wring it, and can you just drape that on me? So I know it sounds weird. It almost felt like I was swallowed up. I was burning up, and I've still got this sort of heart rate now. Like, where's that come from? Now, at the time, my consultant said you're probably getting panic attacks.
Mm.
Okay. I'm going to take you further on now because obviously what I've just said will sort of lead into what the ladies ask. And okay, so now I've gone through surgery. Now I'm going through a recovery period, and things are getting better again. I'm at home and resting up and stuff like that. I'll not drag it. So respectively they would, which they probably did with yourself. You'd do a sort of a 3 month, 6 month, 12-month scan.
Yeah.
Keep checking up on you. Now I'm feeling great, no headaches, the occasional panic attack if that's what they were.
Yeah.
The
Did you go back to work? Sorry.
No, not at the time. No, not at
Okay.
all.
So you're trying to get back to some normality. You're
Right.
having panic attacks. Okay. You feel great. Okay.
The occasional panic attack would still come though. I remember going to a retail park, and as I'm walking up to a branded superstore, I felt it coming. I got that moment of deja vu, and I knew. The first thing I did was go straight back to my van. I opened the back doors and I lay down in the back of the van to breathe, to get my breathing right. So, and I'm thinking, where are these panic attacks coming from? What is it? This? It was honestly, it was doing me head in. I was like, what is it? This? I'm so-called free of Cavernoma. Why this? What else is this? So, sort of moving on to that 3 month scan. So obviously, I've had surgery in June. I've got my 3 month scan September. Results come back from that 3 month scan. We go and have a face to face with the consultant, and he sits down and he asks the usual questions: any headaches, any feeling faint, anything like that. No, been fine. Because you want to express how well you are again. In that sense, you want to let them know
I would say that, especially for you, knowing you now, I think that is a very common thing, because I think we all try and think that we don't want to appear weak. I mean, in any
yeah,
way, do we? We want to be like, oh no, this has changed my life. The surgery was definitely the best choice I ever made, kind of thing.
right. Yeah. We sat down, and he brought these 3 month images on the computer. He said, "That's the image now. Things look good with the surgery that you had, but even the radiologists have called a meeting for what this is here. Now I know I can't show you, but on the image was obviously my brain and where they'd done the surgery, and he zoomed in, Now I'm talking about a quarter of an eyelash. About a quarter of an eyelash. He pointed to and said, "We're not too sure if this here is scar tissue or if it's still a little bit of lesion from Cavernoma."
Wow.
Now, bear in mind, I've not too long ago had my staples out. So at this point, I'm thinking, what do you mean? What do you mean, what lesion from Cavernoma? So now my head's sort of fizzing with what you're trying to tell me here. I said, so what does that mean? He said, well, we're going to obviously keep our eye on it, but what I will tell you is, from time to time, Cavernomas can grow back.
Wow.
And my mum was actually sat with me at the time, and she did that sort of mum sigh thing, you know. So I kind of nudged her and I went, "Don't worry about it." I said, "It'll be fine. We're all right. Don't worry. We'll be all right, won't we?" I said to him. He said, "We'll keep our eye on it." So, you know, I can't remember what happened with the 6 month. I don't think the 6 month one happened. I think they might have obviously been sort of backlog NHS situation. I don't know. But fast forward to May 2023, I remember the 30th of May, I had my scan. Within 2 days of that scan, a letter came through. You have got a face to face with your consultant. And I rang my mum because my mum's a nurse up in Chorley. So I rang my mum and I said, "Have I got something to panic about there? That's come through a bit quick." She went, "No, no, no. They probably just backlog. They're probably keeping up to date with letters and stuff." I said, "Right, okay." So we went to see Mr. Hulsgrove, who was my surgeon, by the way. And again, same thing. Any headaches? Felt faint? Anything out of the ordinary? Nope. He brought this image on the screen. 12 months later, we've got a Cavernoma of 42 mil.
They've grown back.
Over 12 months, it had grown back to the size it was.
Wow. And wait a minute. So you'd had, or you thought you had no symptoms, right?
And I didn't. I just had the occasional one of these panic attacks, as I keep saying to you.
So somebody's mentioned in the comments. So by the way, we will answer all your questions. The reason some of the questions I haven't answered is because I know James's story and I know that he will go through it I kind of don't want to interrupt him. So I know he will answer them as we go along. But one of the comments from Helix Hair is she says she's had a temporal lobe largish cavernoma 3 by 3 by 3 centimeters, still waiting for the blood to clear months later, has vestibular issues, and she's asked if you have vestibular issues. But she's also then said this sounds like focal seizures more than panic attacks.
Well, that's a very educated person, because I was trying to obviously the part and parcel of this, with it being brain awareness, I said to you the other day that this needs to be sort of educational.
Yeah.
So the point I'm sort of trying to get to is, even though I'm saying to you about these panic attacks, I'm getting a moment of deja vu. I'm getting a numbness in my left foot, which then transfers to my left hand. But I don't know what it is. I'm not a doctor. I just think I'm getting a panic attack.
Yeah. And you've also been told that as well. So you're going along with what you've been told, because
Yeah,
at the end of the day, you're trusting the experts, right?
yeah. I mean, my consultant was adamant that these were just panic attacks, severe panic attacks, and whether that's through being in hospital, in a scary place, you're in a sort of a scared mental state. Maybe that's what's bringing it on.
And
Yeah.
have they ever tried to medicate you for them, James? Give you like anxiety meds or anything like that?
Obviously, now bear in mind, post first surgery, I was on lamotrigine.
Okay.
Or so like anti-epileptic.
Yeah, they're epilepsy drugs. Yeah.
They sort of follow up with that anyway. I think that was just sort of a part and parcel of having brain surgery anyway. But yeah, it's just obviously I've had that 12-month scan. This Cavernoma's there again.
Yeah.
Now I'm panicking,
Yeah.
but at that point, I really had to put myself. I mean, when people have sort of surgery, let's say like knee surgery or something, they go on this like huge waiting list. So, I'm thinking, God, well, how long's that going to be to be able to get that out if you're going in again? Um, and why didn't you get it the first time? I wasn't like that, but questions in my mind are thinking, how have you not got it the first time? You know what I mean? Well, I'm gonna
Yeah.
have to go through all this again. And then I sort of calmed down a bit, and I thought, you know what? I'm in the best hands possible for this. Do you know what I mean? I am in the best hands possible for this. And if it's worked the first time, let's make sure it's right the second time. I've just put myself in that mental state of whatever it is situation.
So you didn't have that whole like, why me again?
I'd be lying if I said no. But I think through, again, having to sort of train yourself to think things will be okay.
Yeah.
I've
I guess you've kind of got something to measure it against this time, because last time you went into it completely cold, you didn't know what to expect. Now you've kind of been through it. You kind of know that you've survived it once, so
yeah,
you can do it again.
yeah, I know. It's like again, my mum came with me on the 12-month scan, and when we said, so where do we go from here? Mr. Holsgrove said, I've provisionally put you in for the 27th of June.
Wow.
Like, next month? He said, yeah, next month. I said, so what do you do? But do you go in the same place? Or, yeah, we cut the exact same place and go in again. So I'm thinking, well, I've not got a headache as such. There's no pain. The question on my mind from that point was, what is the likelihood of from now to surgery it busting? And he said very, very low. Then over that sort of couple of weeks, I sort of had to slow things right down. I needed to put myself in that sort of calm, ready for it sort of situation. We had a lovely, lovely couple of days on the coast of Wales, just to sort of get my head clear of what's going on. You know what I mean? And my consultant did say, if you've any questions, you know, ring me, contact my secretary and we'll discuss things. So and he was absolutely great. Anything that I asked, I just said, and again, funny enough, I said to him, he said, have you got any questions? And I said, well, not so much questions, but I'll just say, please don't let me die. that is what I said, please don't let me die. Do you know what I mean? It was just me being me, coming out with that. But
Although
yeah,
that's, I mean, I know you're a bit of a joker. I know what you're like, but I think there's probably an element of truth in there, right? Because as much as we all put on a brave face, I think it's inevitable that we all have that fear of death, right? That we think, you've just got engaged, you've got a fiance. I know people that go into surgery with young children, and they think,
yeah,
oh my goodness, I don't want to leave my children.
yeah,
It's so difficult, isn't it, when you're not only thinking about yourself, you're essentially thinking about everybody, your whole family around you.
yeah. Of course. I mean, look, you're gonna have that faith in you in the best hands possible. You with one of the best surgeons in the country for this, which I was, because my mum did her homework on him. So yeah, it was great. But yeah, again, I'd be lying if there wasn't a small percentage thinking, but what if this time round it doesn't go right? So
Yeah.
I can understand where you're coming from with that. You know what I mean?
And did you do anything differently then? Did you like plan? Because I know when I went into for my surgery, I kind of gave power of attorney to my mum. I was thinking about kind of will planning, like all of these things. Did you think that far ahead, or was it just because it was a month and you were going in a month, you didn't really have an opportunity to plan?
It was just a case of trying to put as much money away as possible because this is round two. You know what I mean? It was
Yeah.
That's all I could do at the time. Obviously, I'm self-employed. It's I need to put as much money away as possible because this time round it needs to be slow. I need to take baby steps in recovery.
Yeah.
So
It's hard, isn't it? And I mean, in terms of like, because a few of the questions that have come in are around obviously the likelihood of having another bleed if you've had one, and yeah, I think both you and I know that that's unpredictable, isn't it? It's a case of I mean, from our experience, the longer you go without a bleed, so every year that you go without a bleed, the less likelihood of having another bleed is. It goes down to percentages, to kind of single digit percentages. I mean, you obviously they'd essentially you hadn't really, from what I understand, you hadn't had another bleed. They just found that it'd regrown. So you were having this out because actually it was causing a problem because of the fact it'd come back and the size of it. It wasn't that you'd had another bleed and you were having issues.
no, didn't have another bleed, but bear in mind, it's pretty much the exact same team
Yeah,
who did it the first time round. So Mr. Holsgrove took care of me from day one
yeah,
and his team. So if you imagine him experiencing how poorly I was when I did have a bleed, he doesn't. He in his eyes, he doesn't want to see me that way again. So I think he was sort of looking at the sort of assessing the risk factor of where this could go.
yeah,
It's best that we do go in and get this, and we make sure we get this.
yeah.
Was to put it blunt for you.
No, definitely. And somebody's asked, obviously there's no simple diagnosis for Cavernoma. Is there they're asking, when it comes to your own health, is there anything that you should get checked out if it's unusual? I mean, are there any kind of quick tips? Obviously for you, that banging headache, which I can definitely relate to. It's that banging headache that you can't really, no medication seems to get rid of.
Yeah, I'll be honest with you. No, one very very silly thing I did. So if I take you back to when I was in the shop after training, and I
Yeah.
and I got a real bad headache, the most stupid thing I did, which probably led it to being even worse, I went and got a box of Anodin from the shop.
Right, a blood thinner, which obviously Cavernoma, you shouldn't really have blood thinners.
Exactly, exactly. So, but I wasn't to know at the time, but that probably didn't help the fact that I was having Anodin, which is a blood thinner. I've got a brain hemorrhage going on. Do you know what I mean? Did that even lead to it? I don't know. It's just. But as far as I suppose when you sort of look at like the headaches, stroke, numbness, speech. These are all sort of common things related to Cavernoma. But one thing I wanted to sort of one thing I wanted to say is obviously wherever the malformation is in the brain, whether it's be temporal, whether it be front, stem, wherever, if that Cavernoma is on the grow, there's obviously going to be some form of inflammation.
Yeah,
The one thing I wanted to sort of touch base with is that different areas of our brain make us sort of react in different ways.
yeah,
So since obviously the first Cavernoma and I'm sort of out of it and I'm clear, I've had 18 months there to sort of educate myself. So obviously you've got your sort of, your brain lateralization, left and right hand side hemispheres of the brain, but then sort of your temporal area of the brain is in relation to sort of being impulsive, lack of concentration, your behaviour, whereas the front lobe would be probably something else like
it's more emotional. It's like, I was crying. I was crying over like nothing,
yeah,
basically.
yeah. So the point I'm probably trying to pick on is maybe sudden behaviour change or sort of sudden mood change could always be just a little bit of a clue. And then what I'll say there is gut instinct. Trust your own body. If you think something's not right,
Yeah.
do something about it.
Yeah, definitely. I 100% agree with that, because I think we are. I mean, and it kind of going back to the beginning of your story, we do doubt ourselves a lot, I think, because we think that these doctors, and I mean, all credit to the NHS, it's absolutely amazing, but we kind of take it at face value what we're told because they are the experts,
Yeah,
and we kind of lose faith in our, because I was told mine was an iron deficiency, I was then told it was meningitis, you
yeah,
know,
yeah.
so I trusted all of that. And actually I look back and I think, well, would my diagnosis have been faster? Would my recovery have been faster if I'd have got to that diagnosis quicker? Because I'd question some of these things, you know,
Mm,
instead of, and I do think sometimes, you know, when we're really sick, it's hard to advocate for ourselves. It's really, really hard to ask those questions.
yeah,
Because I remember for me, it was actually a friend of mine who was with me who basically said, no, you need to give her a brain scan because this is not right. I know what she's like. She's not a drama queen. And I don't know about you as well, but I'm sorry to keep jumping around, but like, I know you said when you woke up and you felt that area of your head and you felt the staples, whatever, that
yeah.
you know you knew it had been done. But I felt that I could feel my cavernoma when it was there. Like I kept pointing to that part of my head and saying, I've got something here. Did you ever feel anything like that?
Funny enough, a couple of weeks, probably about 2 weeks before I'd gone to A&E with this banging headache, there was a couple of times where I'd come home from work and I almost had a very, very, almost like a very tingling sensation on the right hand side temples. It was almost like when you sort of get a bit of a judder,
Yeah.
and I'd get this real tickly feeling sort of down the back of my ear. I mean, joking. This is jokingly. I'm jokingly saying to Shannon, "God, I feel like I've had a bloody stroke or something today."
Yeah.
And I know that sounds bad because I'm sort of joking about it. And she'd say, "Oh, give over, you drama queen."
I love
Honestly, thinking back now, over that 18 months, and thinking right back, it was that something. I'm just thinking now, like, was that something? Was I getting this? I'll tell you another one that's really weird. Um, I always I always sort of heard a sound like you're gonna have to bear with me on this one. So if you imagine you run a bath and you hold your nose and you let your head go underwater
yeah.
and you can hear that, you can actually hear your blood pulse, can't you? You can sort of hear the blood. But it was like I was getting that during the day.
Wow.
I was getting that during the day, and then I get this sort of tingly feeling around my temple and my ear. But again, I don't know I didn't know what it is. I'm just going about my day. It'd go after like 15 minutes, 20 minutes. But again, just to give you an example, yeah, I was getting little things thinking back now. I was getting little things that were saying, there's
Mm.
something there, mate.
And you piece them together afterwards, unfortunately, don't you? But I guess that in a way, and this is why Tim asked this question, I feel like with Cavernoma, because there's so little known about it, you know, you sharing your experience like this could help somebody. Like, even if it's one person, you could help somebody tomorrow who is getting similar symptoms or getting something like that and doubting their own symptoms. And I think that, so Helix Hair has just said, yeah, I had head underwater sound too, and a wave of pressure over my head starting with the neck. That's really interesting because one of my symptoms was I felt I couldn't move my neck, and that's why they thought I had meningitis. I couldn't look sideways. I literally couldn't turn my head. So that was, and that is, by the way, guys, if you're watching and you've asked that question, that has been confirmed by one of our medical experts as, you know, a symptom and sign of a cavernoma bleed, because when you have that bleed, you do start the pressure. Basically, your head, it's a bit like when you break a bone, you get the swelling to protect to protect the joint. It's a bit like that with the bleed. You kind of get that the pressure, because it's telling you that something's wrong. But and somebody asked, by the way, is it the same as an AVM? A cavernoma is not the same as an AVM, because an AVM bleeds a lot faster. So it's like an artery, and it bleeds a lot faster. But also AVMs can be clipped. So they can go in and clip an AVM so it doesn't bleed, whereas a cavernoma, the only possible cure at the moment is surgery. Obviously, they're testing this gamma knife radio surgery, which is radiation aimed at the cavernoma that tries to kind of stop it from bleeding. But the only guaranteed, or I say guaranteed, James, because we're talking about your second surgery. So the only possible guaranteed cure for cavernoma is removal.
Yeah.
But that brings me back, actually, obviously, your second surgery. So you're going in on, what was it, June the 22nd or something, you said?
June 27th.
27th. And this time round, okay, you're like, okay, I've been through this, whatever. How did it feel like coming out of surgery that second time? Was it different?
I mean, I'll be honest with you. Obviously, once you're under general, you've not a clue what's going on anyway. But I'd have said more before they took me into theatre and before general anaesthetic. I felt good, I felt calm than last time because I've not got this bleed. I know what they're going to do, and I know the procedure, but I know I'm going to be all right after this. I know I have every faith in them that they're going to do it this time. And then obviously, I've come round in recovery again with this bandage wrapped round, and I just each to their own, and we've all got our different sort of mental states with the way we would sort of feel things and whatnot. But I just knew, I knew it was okay. I knew they'd done it.
Okay.
I knew that was it.
Okay, so you weren't feeling a level of anxiety of have they got it this time? Like when you went for that 3-month scan again, was there a high level of anxiety?
A little bit, but again, I had every faith in the surgeon.
Okay.
Yeah, with the amount of questions and chats that I'd had with him prior to surgery this time round, it was sort of nailed on. You're going to do it. I know you are. Do you know what I mean? I mean, this guy had even pulled in on his team. I can't remember his name, but he'd pulled in one of the best brain tumor removal specialists as well on his team. Sort of to make sure, yeah, you forgot this bit, mate. You know, that kind of situation.
Yeah.
So he was telling me all this information, and I just had every faith that he was going to do it this time. So, yeah.
And maybe in a way, I mean, look, there are so many different things that get in the way of surgeries. I know for me, I had to wait 3 months because for my bleed to subside so they could actually see it properly. And obviously you were pulled into emergency surgery. So in a way, sometimes that's not always beneficial because when the blood's there, it's harder for them to actually see everything. So maybe second time round, you're in a much different position and they can see it more clearly. They know what they're doing. And, and maybe as well, they're kind of, they've been there. They know what they need to do, like you say. But did anything feel different for you? Were you in more pain? Did you have any other symptoms second time round? Or was it just kind of like a deja vu? This is happening again.
I think, obviously, what you just said there, first of all, about last time there was a bleed, this time there wasn't. I think you're very right in, because there was so much blood on the first Cavernoma, then that is, yes, maybe why there was a little bit of lesion left. Whereas this time round, it's a very clear, crystal clear picture of a Cavernoma that they can easily sort of snip round if that's what they do. I wasn't sort of any different really from the first surgery. Again, I've sort of opened my eyes and I know what's going on, and I sort of know that procedure from there on as far as recovery. The one thing I'd probably say is, now bear in mind they've opened an original wound the second time up. They've gone into the same place with the fragment of skull that they took out. So I did again get quite a bad memory impairment, after the second time round. Um, Struggling movement wise, I was very slow. Obviously, very very fatigued a lot. The slightest thing would, I'd be absolutely knackered. Probably just going to the toilet. I've just been knackered going upstairs and things like that. But I knew that was part and parcel of recovery. But I think from the first surgery, I'd thought, yes, I'm okay, let's go, and you straight back at life as fast as you can. Whereas I suppose a blessing in disguise, it's sort of second time round, give me that second chance to slow everything right down, just slow that pace right down in your recovery. Because
Yeah.
that's, yeah, you know what I mean?
I think for me as well, that would be, and I say this to pretty much every member that I speak to, because I get phone calls every day from our members. We're a very small charity, and most of the time it's me that people end up speaking to. Lucky them. But I always say that that's the one thing, the one piece of advice that my surgeon, Mr. Kitchen, gave me was, do your recovery properly the first time, and you won't have to do it again.
Yeah,
And I'm very much like you, very active, very fast paced. I love living, a very active, fast life.
yeah,
And I definitely learnt the hard way that you have to really pull it back, because it's kind of almost worth making that sacrifice for a few months and recovering well and recovering, strongly.
yeah,
And then kind of returning to your life. And but I also think, James, and I don't know how much support you've had,
yeah,
but my advice to people always is, because a lot of people get told they can go back to work after 6 weeks, and that is a very general rule. That's so general, because you basically get a sick note for 6 weeks. That does not mean that you are okay to return after 6 weeks. It just means that the hospital have given you a sick note for 6 weeks because that's what they can give you, and you've got to go and see your GP for the follow-up. That's what it means. But I think that the other thing is that we see a lot of people just don't get the aftercare. So
oh,
things like physiotherapy, like
yeah,
speech and language therapy, like occupational therapy to help you with your fatigue, to help you with your memory.
yeah.
So people are let down because they don't know what's available to them.
I mean, it was probably about 2 days, maybe the last day before I was actually due to go home on the second surgery. Again, I can't remember her name, but she's a lovely lady. She came and sat down, and she'd go through, do you need any support? Now, from the first time round, I thought, you know what, I do. I need as much support as possible this time. And she was firing all sorts. So there was a neuro office number. You had your occupational therapist, as you said. I said, I did say what I'm scared of is sort of feeling depressed with not being able to do anything.
Yeah.
So then she forwarded me to talking therapies, which then I'd sort of hooked up with doing CBT courses and stuff like that. I can't say it was great for a Cavernoma patient in recovery. And then there was a lovely mention of of a setup called Cavernoma Society, which brought me to you. And yeah, I mean there was a number of different groups and organisations,
Yeah.
but without sort of blowing it. You were the best available from sort of day one of contacting you were great, you know what I mean. So there is, the point I'm trying to get at is even pre and post surgery there's some great help there. Don't be afraid of getting it.
Thank you. And I think that's what it is. And I don't know about you, but I think for me, I had to learn to ask for help. I think that was the hardest thing, having been very independent, very used to kind of just living life as I was. It was actually asking for that help, because once I knew it was available and I'd asked for it, and that kind of initially, like that initial, like, oh my God, this is really hard. Then I saw the outpouring of support, and for me that was life changing, because like getting the occupational therapy, getting the speech and language therapy, getting the physio, I had it for 9 months. I had people coming to my home every day,
Yeah,
and it changed my life. It changed my recovery. And I think that is it. It's asking for that help. But but it is so hard. Sometimes it's so hard. Sometimes you don't know it's available. Sometimes you're not in a position to ask for it. Like even financially, I mean, I know you said you're self-employed. I was self-employed at the time as well. And my biggest panic was I've got to get back to work because nobody else is going to pay my bills. I'd always been reliable with my bills. I'd have paid everything on time. And I also had to learn to go on benefits for the first time in my life,
Yeah.
and B, admit that, do you know what, it was okay if I missed that rent payment, because actually no one was going to die. And I had to just be honest with my landlord that I couldn't afford my rent because actually I wasn't earning any money,
Yeah.
and that he would get some money, but he would have to wait until the council approved my benefits.
Yeah, I think once you explain the circumstances and give them a bit of education on what Cavernoma is, they do feel, they do feel for you, and they think, wow, there is people understanding. It's not something sort of to be scared of. You're not sort of left there to sort of survive with nothing. But I think there does need to be a bit more done for people with Cavernoma as far as help being there, not only yourselves, but financial wise, I think it can be difficult for some people that have to go on benefits, obviously. It's sort of a touchy subject, I suppose. That
It is. Do you find that, sorry to interrupt, but I know obviously we've discussed things like personal dependence payment and stuff like that, and we talked about it a lot at the retreat that you went to in August.
Yeah.
And even, I'm not going to mention any names, but even people from the retreat who were there, who, we saw for ourselves when they were at the retreat, they struggled, they had issues, everyone was very emotional. It was really hard. We were all sharing. And I think this is the power of the community, right? It's that once you're in a room together or you're online on a chat like this, you're sharing your experience, people connect to that and they suddenly go, okay, I'm not alone. I'm not fraud, because I think that's probably the biggest phrase that I hear, the fraud. That is the word that I hear the most, is like, oh my God, I feel like a fraud. My situation is not as bad as yours. And again, I have to repeat, everyone's situation is different. So never ever compare. But the benefit situation, even people from there are like, no, I don't deserve disability benefit. And I'm thinking, but you do. You are living with a lifelong, life-changing, life-debilitating condition.
Right.
That means you are entitled. You are eligible for this. And I think so many people kind of don't apply for them and don't get the help they need because either they're ashamed to, they feel that they're a fraud, or because they've never been on benefits before, they don't even know how to. And all I can say is, we're here as a charity to help you with that if you need it, by the way. We do help with benefits applications. We can advise you on what we feel that you're suitable for, etc. But I know for you understand it's hard to even ask for that help, isn't it?
It's difficult. But I'll sort of revert back to, obviously, if anyone's sort of listening or watching, whatever, if you're considering it, or you think, God, what am I going to do when this, if you're having surgery, for example, and you're thinking, God, what am I going to do then for the next 2 or 3 months? I'm going to be sort of bedridden, and you do need to contact, especially yourself, Simona. Cavernoma Society. Like, I wouldn't have known what to do, where to turn, if I probably wouldn't have got in contact with you guys. So again, it sounds like I'm blowing it up, but it's true. The more help you can get post surgery, or even pre, if you're not too sure, the better you'll be.
You're setting yourself up. But thank you very much for saying that. I mean, obviously, there is other help out there, and Citizens Advice is very, very good as well for these things as well. We did our training. I did my training with Citizens Advice, or a benefits training. But it's Somebody's asked, obviously Tim's commented again and said it ties in with what you said earlier about not wanting to appear weak, which is why a lot of us fail to ask for help. And Ellie's asked, have these panic attacks, she's put panic attacks in commas, inverted commas, gone after your second surgery? Because actually I know you and I have spoken about this, but what's happened since surgery? How have you been?
Right, so no, we're going from sort of the looking after post-surgery section to back. Well, since this second surgery, yeah, I've been a lot better. But funny enough, I've had quite a funny sort of pins and needles sort of feeling in my left foot
Okay.
that would then sort of transfer to my left hand fingertips. So it's almost as if, if you've sort of been leaning forward, or you sort of leaning forward, sat watching something, and all of a sudden you get up and you sort of going, oh, bloody hell, pins and needles. It's almost a bit like that. Kind of thought nothing of it. But obviously it was something to maybe mention on my 3 month scan from second surgery. Yeah. So obviously I sat down with Mr. Holsgrove, 3 month scan post second surgery. Again, he's mentioned any headaches, feeling faint, anything like that. No. But I do want to mention this. I do keep getting these feelings of pins and needles in my left foot occasionally that would then sort of transmit up and into my left hand. Now, again, if we go back to sort of brain lateralization, the left hand side of the brain works the right side motor, right side respectively works the left hand side motor. So if we imagine, let me sort of give you this, that I've had a right side craniotomy. Okay, so yeah, there's a little bit of inflammation still knocking about in there at the time. So now I'm getting these pins and needles in my left side. So to cut the story short, he has said that they were more than likely focal seizures.
Excellent. Okay, so so I say excellent, not in a good way, but like that they finally thought about that. They've finally considered that.
Yeah, because that was only because I'd sort of pushed. I won't say pushed, but I'd. So when I go back about saying about the panic attacks earlier,
Yeah.
they would always more or less start with this funny feeling in my foot.
Right.
That would then sort of, but when that feeling came in my foot, I just couldn't help but get anxious because I knew what was happening. I knew this sort of, I don't want to say fit. Do you know what I mean? I know ultimately when someone says the word seizure, you think about someone shaking on the floor with eyes wide.
Yes.
Right?
There's
But
so many different types of seizures, aren't there?
again, and I've had to educate myself on that to understand what was going on with myself. So this sort of left foot pins and needles would then transfer as it's coming up my leg. I know it's going to go to my fingertips, but I can't control it. So this is where I would sort of lie on my back and I would do these sort of breathing techniques to just lower the heart rate down, if anything. And then after about a minute, if that, it would just slowly disappear, and that was it. So, but now all this way down the line, after let's say 2 years, 18 months, my consultant is obviously now saying, you know what, there were probably focal seizures,
Right.
not panic attacks. Or I think it's been noted down as, have you heard of Jackson Chase?
No.
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 So I'm only sort of going off his report, but he's mentioned focal seizures from Jackson Chase or Jackson's Chase. So
Right.
somebody else in the comments might know what Jackson Chase is, but I think it might.
How does it feel though that after all this time, now you almost have a diagnosis, right? Does that help you, or does that make you feel more anxious?
No, it gives me more of an understanding and makes me feel a lot more comfortable with the life that I've got.
Okay, so now you know that this can potentially be managed, right?
Yeah, and each to their own. Again, people go on medication and stuff, but I've sort of learned to sort of manage. I've learned to manage that on my own.
Okay.
I mean, it'd probably be have to be a different sort of episode with you about it. But I've started to do sort of like things like meditation. A good friend of mine does great meditation, so he sort of taught me the fundamentals in meditation. Just little things that sort of change the way I suppose I think really. But bear in mind, the Cavernoma is completely gone now. I've
Yeah.
been I've been
Now,
given
and have you had, because obviously your surgery was last June, so
yeah
now we're approaching what, 9 months? We're 9 months? Yeah.
yeah. So obviously September
Yeah.
last year I got the all clear anyway.
Okay.
So from the image there was no sign of Cavernoma at all.
Amazing.
On the image it just looked like I had this bloody bullet wound in my brain. Do you know what I mean?
I know, you know what? The first time, I always say to people, the first time I saw that, because I mean, maybe naively, because at the end of the day, how many of us have had brain surgery or know someone who's had brain surgery? Very few of us. It's not like a common occurrence, right? And I remember seeing my scan for the first time and thinking, oh my God, I've got a hole in my brain.
Yeah,
And it was so frightening. It really was.
yeah.
And I just, like, I cried. I genuinely cried seeing that. Because I guess when there is a tumor and it's an external tumor, they remove that and your brain is all intact. But
Yeah.
when your part of your brain is cut out, that doesn't grow back.
No, but like I said, it looks like a sort of bullet hole, if you will. But and when we did the September face to face, and he was showing me the image that the Cavernoma's gone. There's no signs of Cavernoma there. I was saying, well, what about this hole? Is that going to be there forever? I'm going to be able to sort of prod my finger into, just thinking. And he did say that the brain fluid. I mean, our bodies naturally do heal themselves. You know what I mean? So the brain fluid would eventually sort of close this hole up eventually over time. So I think with the focal seizures, bear in mind through the period of me having Cavernoma twice, recovery period, there's been a lot of inflammation up in that temporal area. So
Yeah,
maybe as that has been triggering these, there's still a little bit of blood, scar tissue in there.
yeah,
It could be that that's sort of triggering these little focal seizures.
yeah.
Uh, but yeah, they seem to have sort of
I know you also made quite a big statement with your scar, didn't you? Like you shaved your hair and you made it, I know you grew your hair as well. Have you kind of seen that as your war wound?
You know what? Since you last saw me, I've had a lovely high fade done. I've no longer got that ponytail.
I thought the ponytail was great.
No, I look like a bloody tramp. Give over.
Oh, I thought you suited it. You suited it. But no, I mean, look, it's I think, you've been very I think you've been very brave with what you've been through, James. I'm not going to lie. I think so many people, and you said it earlier yourself, I think you can go either way, right? We all deal with things differently. We all have different emotions. We all have different levels of anxiety.
Yeah,
And there's no real right or wrong. I think, like, in my experience, it's just about talking about it,
yeah,
letting people be
absolutely.
aware of what's going on with you and asking for that help.
Yeah. You've not as scary as it seems for anyone who sort of gets to that position of Cabanoma where they've had a headache for a bit too long, and they go for a scan, they find out that they've been diagnosed with Cabanoma. Don't as you've said yourself on the publishing page that yeah, I've said it. It's not all doom and gloom. There is help. There is people to talk to about it. You can get educated on the way Cavanoma works and stuff. I think it's just frightening because when we sort of talk about the side where there's a bleed on the brain and stuff, yeah, of course that's a scary thing, but there's help. There is help, and I think help matters in situations like that.
Yeah, definitely. And I think, I always say as well, like, to be told that you have, obviously we're talking about brains because it's Brain Awareness Week, but obviously spinal cavernoma as well, they're even more rare. and to be told that you've got a lesion on your brain or your spine that essentially could bleed at any time because there's no, nobody knows, right? That's why it's kind of called that ticking time bomb. I'm sorry, we are going to wrap this up, by the way. Thank you, everyone, for staying tuned with us. I really appreciate it. But I think it's more about, you said about meditation and stuff. I think that those are the things that you can do for yourself, right? It's kind of educating yourself, getting the support that you can. And if you have to live with it because it's inoperable, it's kind of learning to accept and manage it, right? Manage your anxiety, manage, what you're in control of, right?
Definitely, yeah. You can only be guided by your own sort of thoughts and intentions at the end of the day. It's up to you what you want to do, what path you want to take. So if you're inoperable, then yeah, I mean, I suppose, yeah, we've just got to sort of deal with it. But rather than be sort of negative with the future of that, you can train your brain still. You know what I mean? So yeah, you just got to sort of pick yourself up at the right time when needed.
Yeah. No, James, thank you so much. I know we've been on, I promised you an hour and it's been an hour and a half. Honestly, I find your story incredibly fascinating, and I think so have other people, because lots of you have stayed tuned with us, and thank you very much for continuing to watch. If there are any other questions for James, by the way, feel free to leave them in the comment section of this. Yes, I think we will be able to watch it back. I'm going to try and repost this. I will do my best. Apologies if it doesn't work. I will try my best, because we are live streaming on 2 platforms. So I am using a platform to live stream this so that we can go on Instagram and Facebook. But I do believe that on one of them we will be able to keep this. So please do watch back. And if you have any other questions, feel free to either email us. I'm going to put so our email address is hello@cavernomasociety.org.uk. That is all one word, obviously. And then you can probably leave a comment on these lives, and we will pass them on to James. I mean, James, if you don't mind, I know you're not on Facebook anymore, but if you don't mind me passing on any questions, that would be great if anyone's got any specific questions for James. And obviously, if there's anything that you didn't want to ask on the live that you would like to ask him, private. But thank you so much. I mean, you've really come a long way, and I know that you still look, let's be realistic, right? You still have tiredness some days, you still have the fatigue, you still have different things, but like you said, it's about training your brain and that mentality, right?
Absolutely, yeah. I mean, I could go on forever. I'm probably just as much of a talker as you. I mean, I was hoping we could go on to brain foods and how they help us.
Well, do you know what? Let's organise it, because I really want to do a podcast with you. So why don't we do the podcast around brain foods?
Yeah, absolutely. I mean, I was going to start telling people that they need to eat salmon, leafy greens, and blueberries, for God's sake.
Do you know what? Do you know what? Again, look, we can go into this all day. Like, I remember, like, most people that phone me, and I know one of our members, the first time she phoned me, I remember saying, eat avocado, eat nuts, eat high fat, good high fats, because people avoid those because they think, oh my God, we're going to gain weight after surgery or after a bleed. But actually, that is what your brain needs to recover. Like, that is what you need the most of. So, let's do something on brain foods. But thank you so much. So, Rachel said, inspirational. Thank you both. As Sharon says, amazing, James, on your Cavernoma journey. Pink is salt. Says thank you both. And Helix Hair says, good to hear your story, James. Thank you so much, Simona. So yeah, thank you so much. Brilliant interview, James. Glad you're getting the message out there from Crazy K. Thank you so much, James. Really, really appreciate you. And guys, we will be looking to do another retreat soon. I know James came to one of our retreats last August, and so that is the time to be getting people together and meeting people. We will be trying our best to do these online groups and stuff for support. So you aren't alone. James has shared his inspirational story. Please feel free to get in touch if you have any questions. And yeah, we'll be live again tomorrow. I'll be live tomorrow with Emily, who is another. She's had surgery as well, and she has completely changed her career and started a new business. So we'll be talking to Emily. But James, have a lovely evening. And I look forward to speaking to you again soon and seeing you.